When evaluating kidney function, most people focus on individual lab values, blood urea nitrogen, or BUN, and serum creatinine. But clinically, the relationship between these two markers often tells you more than either one alone. This is known as the BUN-to-Creatinine ratio. BUN reflects nitrogen waste from protein metabolism, produced in the liver and partially reabsorbed in the kidneys. Creatinine, in contrast, is a byproduct of muscle metabolism and is filtered with minimal reabsorption. That difference is critical because under certain physiological conditions, BUN can fluctuate independently of creatinine. In a typical setting, the BUN to creatinine ratio ranges from about 10 to 20 to 1. When this ratio increases above 20, it often suggests a pre-renal state. The most common cause is dehydration. Here's why. When blood flow to the kidneys drops, the body compensates by increasing sodium and water reabsorption. Urea follows passively, so BUN rises. Creatinine does not reabsorb to the same extent, so the ratio increases. In contrast, when the ratio remains normal or even decreases despite rising creatinine, this points toward intrinsic kidney damage. Conditions like acute tubular necrosis impair the kidney's ability to reabsorb urea. So, both BUN and creatinine rise, but the ratio stays closer to baseline. This distinction matters because pre-renal conditions are often reversible with volume repletion. But intrinsic renal damage requires targeted intervention and closer monitoring. Now, integrate this with estimated glomerular filtration rate, or eGFR. A declining eGFR confirms reduced filtration capacity. But the BUN to creatinine ratio helps you understand why. Is it reduced perfusion or structural damage? Also consider context. High protein intake, gastrointestinal bleeding, or corticosteroid use can elevate BUN independently. Low muscle mass can reduce creatinine. So, interpretation must always be clinical, not isolated. The takeaway is simple. Don't just read BUN and creatinine separately. Use their ratio as a functional marker of renal physiology. It provides insight into volume status, tubular function, and the underlying mechanism of kidney impairment. For anyone monitoring kidney health, especially in chronic kidney disease, this ratio is a practical and underutilized tool. It helps guide early intervention, prevent progression, and improve long-term outcomes.